So, welcome to episode 32 of Taking Charge of My Cancer podcast. I have a very special guest with me today, Dr. Amy Morris. So, Dr. Amy Morris is a cancer survivor, a fearless advocate, and creator of the Cancer Freedom Program. She brings empowerment through knowledge by countering stubborn cancer myths with facts and over 13 years of clinical experience. Dr. Amy's evidence-based approach will have you dropping weight in forced menopause, hot flash free, and reclaim your energy after cancer. So I'm super excited to hear everything you have to tell us, and Dr. Amy, but thank you so much for being here with us tonight.
Hey, thanks for having me.
Absolutely. So you want to tell us a little bit your business and your mission?
Yeah, for sure. So I am a cancer survivor myself. I had stage 3 ovarian cancer in 2016. And, before I was diagnosed with cancer, I was already working in cancer care. Is a little bit of the ironic part to this. So I started my career in cancer care in 2010. I started caring for people who had been diagnosed with cancer really just in the cancer treatment center, like as they were getting chemo, as they were getting their treatments. And I just loved the work so much. I was always drawn to working in cancer care. I never really knew why, but I just loved it. So then I decided I would go back and I would do my doctorate degree. So I did that, University of Toronto, came back home, went back to work. And shortly after that, I was personally diagnosed myself.
Wow. Mm-hmm.
So once I went through all of that treatment, the chemo, the surgery, I started my own recovery and it was awful. It was terrible.
Mm-hmm.
I had gained 20 pounds and I could not figure out how to lose it. I was exhausted. I was so tired all the time. And I just ached. I ached. I felt like I was trapped inside the body of a little old lady.
Got you. How old were you when that happened?
So I was diagnosed when I was 30.
Wow. Mm-hmm.
Yeah.
Yeah.
So, after going through that, and I just realized I can't live the rest of my life like this. I can't live the rest of my life uncomfortable in my body.
Mm-hmm.
Right. And so I started researching and looking and, look, I have a doctorate degree in this subject. I was like, I'm the person to figure this out. I am put in this position uniquely to figure this out. So I went to work and I researched and I spoke with people from across the world, trying to figure out what's the best strategies to recover.
Mm-hmm.
And that's really how the Cancer Freedom Program was born. And so that's what I do now is I help women recover from cancer and cancer treatment.
That's amazing. That's so great. So I guess, were you always planning to do this way before you were working with cancer, even before you're diagnosed, or were you thinking to do something different?
Like I mentioned, when I was going through my own recovery, that's when things really pivoted for me.
Got you. Sorry, how about before that?
Before that, I was working with women in the cancer center. So during treatment.
Okay. So prior to all that, were you ever thinking to do something completely unrelated or no? So you always were driving?
My life has always been in cancer care.
Got you. Perfect. So with you, I'm sure that with this program I've been listening to your podcast and they're great information as well. But if you can give us 3 valuable tips that you learned through your journey for the audience, what will be those?
So 3 valuable tips. Do you want to narrow it down at all?
You can, whatever you want to do. I mean, you have so much information to give out. So.
Okay. So if I were to think about 3 things that I would want to do in my own cancer recovery, the 3 things that I would focus on are first, that I would need to be eating more lean protein. So that is number 1. And almost all women who come to me in the Cancer Freedom Program, they are not eating enough protein. Okay. So look, it's no one's fault, right? Because our food, our cultures, especially in North America, it's carbs, right? Carbs are delicious. Carbs are fast, that, of course, right? Carbs are easy to come by. Okay. But it's protein that your body needs to recover and heal. So every meal, I would have you aim for 30 grams of protein at every single meal. Okay. And look, that's the starting point. Your protein needs to be customized to you. It needs to be specific to you and your body. And so 30 grams of protein is a great start at each meal, but that's not the end. We've got to really customize it to you. Okay. So
Yes.
that would be number one.
Sorry,
Then,
can I ask you a question about that? Will you increase that intake while you're going through treatment? Or
yes,
yeah, like if you're going through
yes,
chemo, you're going through
correct,
radiation. Okay, so
yes,
what
yeah,
will be kind of, I know you're saying it's customized for each patient, but how much increase you should take during
yeah.
that time?
That's a great question. And I mean, that really is dependent on the type of treatment you're in, right? I know lots of people say to me, well, how much protein should I be eating? And unless I do a full assessment on you, I'm really just doing you a disservice. So
Got you.
in the meantime, until you can meet with me, until you can reach out to me, just start by eating more protein because you likely just need more.
Okay, perfect. And I listened to one of your talks about that. And I have been, so as you know, I'm a physical therapist, oncology specialist. So, that's what I treat all day long. So since that's exactly what I've been telling patients. I think in one of your talks, you were talking about 23 grams of protein.
Mhm.
So I've been telling them, you gotta listen to this, Dr. Amy Morris, and she's really talking about this. So that has been, so my advice to patients to beginning with, and then I just tell them, just talk to your medical oncologist, just kind of see what else, or your nutritionist to see what else you need to try to increase that part.
Yeah.
If we don't have a Dr. Morris around here, who would you recommend them to go to talk about? Like, okay, so what is exactly my intake of protein?
Yeah, come and talk to me. I work with women from all over the world.
Okay.
So no matter where you are, what type of cancer, even if you just have a genetic predisposition to cancer, you could have had chemo, radiation, or none of the above, still I can help you.
Okay, perfect. Awesome. Okay, number two.
Yeah, so number two would be to focus on eating plant forward. Okay. So when you dish up that plate, I've now said 30 grams of protein, but now you need to make sure half of that plate is vegetables. Okay. Now a half plate of veggies is a lot. That's a lot of veggies. But I
Mhm.
want you to focus on building up to that half plate of veggies because you need the antioxidants and fiber that's in those veggies to really fuel your recovery and remission.
Okay, perfect.
Mhm. And then number three, and this is one of the most important ones if you want to hope to stay cancer free, is to use targeted exercise.
Mhm.
We know that women who hit target exercise levels, they can lower their risk of a cancer recurrence by up to 59%. So
Mhm.
59%, you lower your risk by that much. Like, yes, please, I want that. Okay. So that's exactly what I would focus on: lean protein, half plate veggies, and targeted exercise.
When you mentioned, because I'm really big on that, of course, being a physical therapist. So we have, are you familiar with the InBody? Like a
Yes.
body composition. So
Yeah.
we have one.
Yeah.
So that has been a great tool for education for patients, right? Because they actually see in numbers how much is skeletal muscle mass, how much fat, and we talk about breast cancer recurrence, PR positive, ER positive, and even lymphedema, right? We know
Yeah.
that somebody with postmenopausal higher BMI higher than 29 have 3 times the risk of developing lymphedema. So we really use that for that. So what we do is we try to really get them into working into 70% of the max heart rate. So we're talking about high interval training programs, modify it to whatever they're capable of doing.
Mm.
Is that something that when you talk about targeting exercise, would you expand a little bit on that?
So when we look at targeted exercise, we have to look at what the literature has shown in terms of reducing your risk of cancer. So there's really two different prongs that you have to focus on. The first is cardio,
Mhm.
okay? And the second is strength training.
Mhm.
So those two need to happen together. So
Mhm.
lots of times women especially will gravitate towards cardio because
Mhm.
hey, like we all know how to walk, right? Like we can all do that, right? And lots of times, depending on where you were raised and how old you are, like strength training wasn't very accessible to women in the past.
Mhm.
Okay. At least it wasn't to me when I was growing up. And then it wasn't until that I realized my athletic potential that I really started getting into strength training. But for a lot of women, they just haven't learned how to do it the proper way. But now's the time to learn because it's going to reduce your risk of recurrence.
Okay, perfect. Have you talking about that, when we talk about the strength training, a lot of correlation, sometimes my spell goes to a lot of the women who are in endocrine therapy, right? So how that can create some of those AIs can create some osteopenia, osteoporosis. So I try to really educate patients in increasing that skeletal muscle mass actually will improve some of that bone health. Would you add something to it?
Yeah. So, I mean, I love that. First of all, the second thing that I would add is we need to do some jarring type of exercises. So, what do I mean by that? Right? Like jumping, skip rope, burpees, gosh, right? But those really help to improve that bone mineral. Well, you can't improve it necessarily, but to sustain that bone mineral density. So, if you can do something to really, do some box jumps, like, something like that that's really jarring, that's going to help with that as well.
Okay, awesome. I would like to ask you something to see how much you know and then how much you have been advising this. But I work at UF here in Gainesville, and then we did a research that was on animals, wasn't on humans yet, because then COVID came in about exercise prior to chemo and radiation and how that can enhance
Mhm.
chemotherapy treatments and the radiation treatments. Do you know
Right.
anything about that or anything that you would like to
I'm
add?
not familiar with that piece of literature. Sorry.
Okay,
Mhm.
that's all right. That's all right. No problem. Okay. How about your most painful lesson?
My most painful lesson, I would say, was to stop listening to people that want to give you cancer advice, but don't know anything about cancer. Okay. Like I don't know why the cancer space falls victim to this so often, but like I always compare it to this, look, like I know when I was going through my own diagnosis, like an older man at the gym I went to, he told me I need to stop eating sugar. Okay. Stop eating sugar. That's what fuels cancer. Stop it. And of course, that scares somebody, right?
Yep.
Okay. And
Yes.
it's always the people who are eating sugar themselves that have that recommendation. I've now made a rule like you cannot make that suggestion unless you personally don't eat sugar. Okay. But like, look, this individual, he was like maybe an IT consultant. Like he didn't know anything about health, nothing about cancer, but he had saw some YouTube video on it. So he felt the need to give me that advice.
Uh-huh.
Okay. It's actually really harmful to cancer survivors. We know that cancer survivors get a lot of food rules pushed on them. And as a result, we're seeing more and more people diagnosed with cancer actually having eating disorders
Mhm.
after their diagnosis. So they've never had an eating disorder before, get cancer, have all these food rules, and develop eating disorders later in life. Like
Mhm.
this is a serious thing, right? And I always say like, hey, I don't go to my mechanic and say like he or she will say, oh, I think this is what's wrong with your car. And I say, I don't think so. I saw a YouTube video on it. I think I'll just rub coconut oil on it and it'll be okay. Right. Like,
Yeah.
cause I respect his opinion. And I'm not saying like, don't question your docs or don't question your healthcare team. Of course, I'm the most annoying patient there is, right? I question everything. But I think perhaps like a YouTube video isn't necessarily like the answer in this case.
Got you, got you. Now you mentioned something about sugar. You want to tell us a little bit about, how true that is versus a myth? A lot of people is like, oh my God, I cannot have sugar. I cannot have soy sauce, those kind of things. What are your
Mhm.
thoughts about that?
Yeah. Yeah. I think when we look at like food after cancer, there's very few things that truly increase your risk of cancer. Okay. There's very few things that if you eat them, they will increase your risk. Very few. Instead, I want you to think about the foods you can include to lower your risk of cancer. So you need to eat more of certain types of foods to lower your risk, like more lean protein, more vegetables. Okay. This is a place of power, right? If you can fuel your recovery, fuel your remission, that gives you confidence, power, strength. But
Mhm.
if you're scared of food, well, that's all fear based. right? And
Mm-hmm.
there's not even good evidence behind it. So I would rather live my life from a place of confidence and power as opposed to a place of fear.
That's good.
So,
Yeah.
mhm.
Yeah. That's a great advice. Great. So is anything that you have that will be a value for the audience? And again, you have 1,000 things. I can talk to you for hours. So will be a couple of things that you would like to share.
So what do you mean by a value? Tell me more about that.
So, like, this podcast is being, so cancer patients are listening to this. So, cancer patients, caregiver, healthcare providers. So,
Yeah.
if they're like out there, like, going through where you went through, either from ovarian cancer, brain cancer, head and neck, breast cancer, what will be something? I mean, you gave us really three good points. If besides that is anything else that you feel is super important.
Yeah, I think once you get to the end of your treatment, whatever that's like for you, if it's surgery, chemo, radiation, whatever that's like for you, I think a lot of people get told like this is just your new normal. They say, oh, you're tired, you've gained weight, you have hot flashes, joint pain, can't sleep at night. This is just your new normal. This is the cost of being cancer free. Like, be happy, be grateful, right? And it's not true. It's just not true. Like, new normal, that's a term of complacency.
Mm-hmm.
That's just saying, like, just don't bother doing anything about it because it'll never be better than this. And
Mm-hmm.
that's not true. That's not true. Women come to me all the time and they say, I just want my old life back. I know I'll never get my old life back, but that's what I want. And the women that I work with in the Cancer Freedom Program, they don't just get their old life back. They get something way better than that.
Mm-hmm.
You can be the healthiest, the strongest, the fittest version of yourself ever. Forget before or after cancer. Like, we're talking ever in your life, and you can do that now.
Yep.
So I feel like if a clinician tells you, oh, this is just your new normal, then say, great, thank you. And then promptly dismiss that because
Yep.
that is not true.
Yep. Yep. That is so true. From the rehab standpoint, I have seen patients that come with some, cancer metastasis.
Yeah.
And many times they come across and say, well, I have this back pain, which is
Yeah.
normal, right? Because now I have bone meds. I have
Yeah.
pains, I have some meds on my spine. So I'm expecting to have pain. And again, that's my for like, no, you're not expecting to have pain.
Mm-mm.
If we can do something to improve your quality of life, and with that take some of your pain away, and you may have some days, and yes, it's things that if you have this bone mess, you're not expecting to do 100 pounds squat lifting or anything like that, because we know the bone can be a little bit in danger there, but that doesn't mean you can do other things to really improve your quality of life and try
Yeah.
to get where you need to be. And it is amazing. They're like, oh my God, I feel like the best I ever feel even before cancer, because they
Yeah. Yeah.
charge it, because they're healthier, they eat healthier, they're more active, they do more things. So that has been really a great feedback from them.
Absolutely. Like, I've worked with many stage 4 survivors in the program, and like, look, they are like, when it's summer, they're like out on the boat, they're hiking, they're traveling around the world. Like, I'm not talking about you have to be free of disease, right?
Yep.
You don't have to be cancer free to be healthy, fit, active. Like,
Yep.
you can still, even if you have residual disease, you can still be like this amazing version of yourself.
Yep. Yep. That's really well saying. That's great. How can people find you? And I will put that info on the description of the podcast, but you want to tell us that?
Sure. Yeah, you can find me Instagram and YouTube are my two biggest platforms. You can find me Dr. Amy Cancer Recovery on Instagram and YouTube. You can also go to the cancerfreedomprogram.com. So that's cancerfreedomprogram.com. And you can find me there and apply for the program.
Okay, perfect. How about three books that you would recommend for the audience?
3 books. Okay. I have to go Mindset by Carol Dweck. That is my absolute favorite book. I read it probably once a year. If you're really wanting to change your cancer recovery and remission, start there because that is amazing. Okay. So that would be my number one. Now my number two would be, what's it called? Be Your Future Self Now. That's by Ben Harding. Be Your Future Self Now. I like that one as well. And then, hey, how about a personal plug for number three? How about mine? 100 simple cancer recovery recipes for
That's
women. There it
awesome.
is. You can find it on Amazon. I sell it on Amazon.com, Amazon.ca, and I sell it for the cost of printing. So it's the cheapest that Amazon will let me sell it, or you can get the Kindle version of it, $2.99.
Perfect. Will you tell me how that whole idea started?
The recipe book?
Yes, yes.
Oh, yes, for sure. So I have a free recipe book that you can get if you go to my Instagram page. It's the link in my bio. And it's 15 recipes. And people love this recipe book so much. It's been downloaded thousands of times. And so I got asked over and over again, like, create a full length version, like make more lunch options, more dinner options for my family, more of everything. And so I think, just about 2 years ago, I put together this 100 simple recipes for women. So this is a good one to get.
And then how did you even start thinking about putting recipes out there? You just start doing things for yourself, and that's kind of, you feel like that was a really good tip to help other women going through this? How
Yeah.
the whole thing start?
Yeah, well, these recipes in this book, they really are recipes I use with women in the Cancer Freedom Program. So they're really recipes that I reference back to over and over again. If they're struggling with getting enough protein, if they don't know what's going to make, them and their kids happy, whatever that is, these are recipes I reference back to all the time.
Okay, great. Yes, I download your free one, looking into some of this, some
Mhm.
observations, some kind of tips. So great,
Yeah.
that's good to
Yeah.
know.
Yeah, it's filled with little tips for cancer recovery and remission as well.
Okay, perfect. Um, you mentioned something about how about like any tips on like these hot flashes? A lot of these women are in endocrine therapy. So any other tips to help with that?
Yeah. So there's really a few things that we have to do to get rid of the hot flashes. And the good news is that you can absolutely be hot flash free, even when you're on tamoxifen, anastrozole, letrozole, exemestane. After a hysterectomy, like, you can be hot flash free. It's possible without drugs.
Mhm.
Okay. So the first thing we have to look at is your nutrition.
Mhm.
Okay. We can really change your hot flashes through your nutrition.
Mhm.
And look, you don't have to give up a bunch of foods that you love, but we do have to be more strategic about how you're eating. Okay. So that's number one. Then the second thing we have to look at is your mindset. Okay. Because
Mhm.
we know that women that have higher anxiety levels,
Yep.
more of that fight or flight response, they have 3 times the number of hot flashes. So like 3 times the number of hot flashes, like that's awful. Like, I'm getting a hot flash just thinking about it, right? And so we really have to focus on mindset, because that is controlling every time, like, you open an email that's a little bit confrontational, anytime that you like, oh, I forgot to send the kids lunch with them or whatever that is, you're going to get a hot flash if you're triggered so often. Okay. And then the last thing we can do for hot flashes is use really strategic exercise. Okay. So we know that if we go high intensity, but make it that it's, what's the word? Inconsistent. So if your girlfriends are like, hey, we're going to the spin class, want to come? And you're like, well, yeah, sure. Okay. And you hop in and you do a spin class, once, and then you don't do anything for a week. And then, that type of exercise, it can make your hot flashes worse.
Oh, that's very interesting. Yeah.
Mm-hmm.
So the consistency of doing them will help with them.
Yes, because you're likely to get a small flare when you first start exercising.
Yeah.
If you're not really physically active right now and you start to exercise, you're likely to get a small flare, and then it will drop.
Okay.
But you've got to stick it out, right? And so what happens to a lot of women is they're like, this is the week. This is the week for me to be fit. Okay. And I do this too, right? It's Monday today. I'm going to exercise this week. And then Thursday rolls around and it's just like a little too busy, and I'm too
Only
tired.
one more
Yeah.
day of the week.
Yeah. Yeah. So that can actually make your hot flashes worse.
Okay, got you. And the other thing I came across a lot, patients, is anxiety, right? Of course, anxiety for where is coming when you're going through a cancer treatment, the anxiety of is coming back to me, the anxiety every 6 months that you're having another MRI or a PET or, your year mammogram again or whatever goes on for surveillance. So any advice on that?
Yeah, that's a very common problem, right? Anxious that you're going to have recurrence, anxious that you are going to die from this, right? Even if like I've worked with lots of stage 0, stage 1 survivors, and they just feel like it's their death sentence, right?
Mhm.
That's normal. And like if women feel that way, they are not alone. There's a lot of women that struggle through that.
Mhm.
What I've found that's helpful for women who feel that same way is that we really have to focus on 3 different things. Okay. So the first is you need a plan. You need a plan to lower your risk of recurrence.
Mhm.
Okay. Without a plan, you just feel like you're scrolling social media or Googling things late at night and trying to piece together some way to lower your risk.
Okay.
Okay. But you need a plan of science-backed ways that you can actually do that. Okay. So we all feel better with a plan. Okay. So that's the first thing. Then the second thing is you need a community of thrivers around you. Now, I'm not saying survivors, I'm saying thrivers. Okay. Because when you were in treatment, you needed a different community than what you need now.
Yep.
When
Mhm.
you were in treatment, you needed other women in treatment.
Yep.
Right.
Mhm.
And now that you're done, you need women that are like thriving after cancer, right? They're the women that are back to work. They're vacationing with their families. They're doing all the things, right?
Yep.
You need that as your North Star. That's what you're aspiring towards. Okay. And then the last thing is we need to do mindset work. Okay. If you don't have a therapist, you should have one. If you haven't done any mindset work, that's got to be part of your plan.
Okay. Perfect. Good advice. All right, let's go back into the question here. How about 3 movies would you recommend?
3 movies. Well, my favorite movie of all time is Princess Bride. So for sure, that's got to be number 1. Okay. Not many, that doesn't come up very often. Not many people know that about me, but Princess Bride, I could probably recite every line. Okay. Um, Now other movies. So I'm trying to think of something with good substance here. Oh, I don't know. I'm not sure. I mean, let's see what else I usually watch. Well, I saw the Barbie movie. It was very good.
Yeah, you
Um,
like it? I
ah,
haven't seen that yet.
yes, good. Other than that, I watch a lot of Disney movies. My kids watch a lot of Disney. I was raised watching Disney, so we do a lot of Disney movies.
Got you, got you. And then how about podcast?
Podcasts, yeah. Well, um, my favorite podcast. Well, I'm a British royalty fan. So I listen to a British royalty podcast to get all the inside track and the gossip. Okay. And then I also, well, the Cancer Freedom Program podcast. So Cancer Freedom
Or
Podcast. I got to mention that. Okay. And then I was just listening to one the other day. Let me see if I can pull it up because there are so many good podcasts out there. What was I listening to? Where is it? Oh, I was listening to the Gold Digger podcast by Jenna Kutcher.
oh, nice, nice. Great, great. That's a good one. And okay, is any one question you wish I will be asking you and will you be answer it?
Hmm. No, nothing that comes to mind really.
So let me ask you something. So when you were diagnosed, did you have your kids already?
No, I did not.
Okay. So you want to tell us a little bit about how is that whole process, right? When you're like so young and you've been diagnosed and then, start talking about fertility. How is
Yeah.
that process a little bit?
Yeah. So that is something that's so underserved for women who are diagnosed with cancer. Like it's really just like an afterthought for a
Mhm.
lot of oncologists about preserving fertility or even asking the question about fertility. Like as women get diagnosed younger and younger, it's going to become more and more prevalent that we need to start asking these questions, because for a lot of women, it's everything,
Yeah.
right? They want to be able to at least have the choice, and as you should, right? You should have the knowledge and be able to have the choice. Now, the good news, that's kind of the glum, but the good news is that we're getting more and more research, especially among breast cancer survivors, to show when it's safe to pause hormonal therapy and attempt to conceive. And so we're getting really good literature now to show that it is safe and that you can pause hormonal therapy in an attempt to conceive. So, I mean, I'm hopeful for the future, but definitely something that needs more attention.
Okay, perfect. How old are your kids?
My kids are 18 months and 4 years old, four and a
Oh,
half.
wow. Yeah.
Mhm.
Little ones. Yeah.
Yeah,
Yeah.
they are. They
Yeah,
are. Yeah.
that's awesome. That's really awesome. Well, I
Mhm.
think that that was really, really helpful. I think that's going to bring a lot of great information to people out there listening to you. I really appreciate you being part of this and help out with education. I really appreciate it.
Well, I thank you so much for having me, and congratulations on your podcast. I know it's not an easy road to go down.
Yeah, yeah. Thank you so much for being part of it. I really appreciate
Okay,
it.
well, just tag me whenever you release it early, and I'll be sure to reshare it. Okay.
Okay, perfect.
Okay.
Thank
Okay.
you.
Okay.
Have a great
Bye.
evening. Bye.
Bye.